Welcome back to The Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes with your host, Dr. Rhiannon Winsor. Dr. Winsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she's spent her career helping clinicians and care teams optimize patient outcomes. You'll also hear from Benj Brayman, our media and graphics design producer here at the Exam Room podcast. Benj brings over a decade of experience producing multimedia content in the healthcare space, including work with major organizations like the Core Institute and the University of Phoenix. From video production to motion graphics and audio storytelling, he's the creative mind behind how this podcast looks, sounds, and feels. And when he joins the conversation, he brings a unique perspective grounded in both design and real-world healthcare experience. What happens when your health center faces uncertainty, whether from legislation, funding changes, or organizational shifts? In this episode of the Exam Room podcast, Dr. Robert Babyar joins Dr. Rhiannon Winsor in the Exam Room again. This time, to talk about leading through change with transparency, optimism, and a steady focus on mission. From innovative internal communications to staying prepared for Medicaid changes, we cover how to keep staff engaged and ready for the future. We thoroughly enjoyed this conversation, and we're sure you will too. Let's get into it.
I'm starting to get a very clear picture of why Adelante Healthcare is so successful. So much heart coming through in what you guys do, and we talked a little bit about the mission moments, but you had also mentioned in a previous conversation that you do town halls?
Yes. The town hall is an internal communication. So every quarter, the executive team, and we've expanded it to include other members of our leadership team and other members down lines to come in and talk about the priorities from the previous quarter, what's happening, what are the things that we need to know, and then we'll answer questions. So we videotape about 40 minutes of that lunch meeting so that we have it in a setting where it's logical and makes sense, and we know what we're talking about, and we can, when we flub through something, we can fix it, right? So we do that, and what we've recently done is we've taken it to a more conversational style with some of our other leaders. One of the things that's unfortunately happening is we have to close down a location at the end of September. We were unable to continue the lease where we were at. We looked to try and find another location, but wherever we went to was going to be temporary because we will be building a brand new, bigger location to serve that same community, but it'll be ready in 2027. It's a large collaborative venture with a number of developers and the city of Phoenix to do a whole complex with low-income housing, healthcare, other small businesses, nonprofit businesses having space on the campus to do those things. But that's development, that's architecture, that's building and construction, right? And that all takes time. So we couldn't find a place that worked for us for a short term, so we're having to close that down. We had that on our last town hall. I spoke with the area operations manager and the site administrator for that site to talk about what are we doing, why did it happen, how are we going to make sure that our patients are taken care of, how are we going to make sure that our providers are taken care of. All of our staff that were working at that site have elected to go to other places, other opportunities that we have in the organization to continue to be a part of Adelante. That's the town hall. We also do what's called a daily dose. These are members of each department selected, not necessarily the leader of the department, but selected by their department to present something interesting in a minute to a minute and a half on what they're doing in their area. What's happening, what's important to know. We had the billing team come in and throw a pile of envelopes up in the air and say, these are all the returned billing statements because we don't have the right address? How can you help us make sure that we have the right address to put these things out, to get these things handled and addressed? There is still a business side to what we do, right? And if you ignore it or say, I don't want to talk about it, that isn't helpful either. So how do we work on making sure that we have the right address, that we have the right information for those people? It's fun stuff like that. We actually had our operational site visit last year, and the group that came out from HRSA, we scored perfect on our site visit. We didn't have any deficiencies, didn't really have much to change or do better, and they loved what we were doing. They did a daily dose for us before they left to tell our staff, because this goes out to everybody. It's available on our intranet page. It's available, it gets dropped in people's emails. They wanted to tell everybody how good we had done and give us those positive pieces. They enjoyed that concept and were like, we want to do one. And we said, sure, let's do one. So we had them do one. So those are ways that we try and increase the internal communication for the broad issues, right? There are big, broad issues that it's hard to get individual with everybody, and email isn't always the best route for that. From the provider standpoint, we have a quarterly provider meeting. It used to be that we did those in the evening on 1 month, every 3 months we do it in the evening on a month, and people weren't necessarily happy with having to give up their evening. I don't disagree. I didn't like being out till 9:30 with all the conversations we were having. And with COVID, it really changed how we had to look at those meetings. So what we've changed to, and I think this has been helping, is 2 of the quarters in the year, we do a virtual 2-hour over the lunchtime meeting with the executive team and a lot of the business piece of what's going on to keep the providers engaged and informed with that. We do give them time for a small breakout based on their departments as well, because we've got them spread out across the county. So how do we get those departments? But twice a year, we do a half-day, shut down the clinic, bring all of the providers in each of their groups together. So all of our medical providers and their integrated teams come to one site. All of our dentists go to another site. All of our behavioral health department team goes to a third site. We have the executives come out to give the executive update, but then it's that leaders meeting. So for the medical department, there's always a breakout for the different departments in medical. OBGYN, pediatrics, adult medicine, integrated care, right? They all have a chance to do a breakout for their small group. And then there's trainings, there's education, there's other information so that we have that ability to get some more communication out there. I feel like those have worked out pretty well. I haven't heard any really bad reviews other than, well, I have to drive a long way for that meeting depending upon where you hold it. And we rotate where they are. So we have a big site in Mesa, one in Goodyear, and one in West Phoenix at the old Metro Center location. So each quarter that we're doing the in-person, it rotates. So it isn't dental always having to go to Mesa, right? First it's in Mesa, then it's in Goodyear, then it's in West Phoenix, and then we rotate. I think that's helped, and it's an in-person meeting. It's a required in-person unless you're on PTO or that, but we don't do any virtual for that meeting because we really want the engagement across locations of the providers. If you're struggling with something and oh, hey, I talked with that doctor at the meeting and he said if I ever had questions to call him, I'm going to call him and see what I can do because I'm not certain with this patient, because they don't call it the practice of medicine for nothing. There's always something more to learn or know, or things change. So. Yes,
absolutely. The communication sounds like it's top notch, and we've had many conversations in the exam room about the importance of communication. I think as a whole, Adelante's vision, their ability to think outside of a box, to receive feedback and pivot or change based on that, all of those things are so pivotal to success, to any endeavor, right? But we're dealing with patients' lives. So if we can't do that, then our patients will feel the brunt of that. Going back to a conversation we had previously, we were talking a little bit about what's going on as far as legislative changes. And you shared with me a really positive spin that you have, like this outlook. And I know that there's a lot of fear associated with the things that are happening or might be happening. So I would love it if you would be willing to share your thoughts on that.
So we'll talk a little more general on those pieces. You know, the question of what's going to happen with Medicaid and who's still going to have Medicaid as a payer and who's not going to have Medicaid as a payer. We recognized, because we've been through this before, back in 2012, they reduced the expanded Medicaid and those childless adults who they're mentioning now lost coverage. So we know there's going to be some decrease there. What I believe is that community health centers are recognized as a vital piece of being healthy. It's not just treating the chronic, it's doing the preventive care as well. And with that, I believe that from the Medicaid standpoint, we're going to get more of our Medicaid patients across the state and across the counties using community health centers. I fear that that'll be their only option, that private providers will not take Medicaid anymore because of the cuts and the reimbursement changes that will most likely be coming for them. Our reimbursement is a little more steady with Medicaid because of how federally qualified health centers are reimbursed on that program. So I believe we're going to be that provider of choice for the Medicaid population here as these changes take effect. Now, they keep saying they're going to take effect somewhere in the future. First is 2026, and then maybe it's 27, and then maybe it's 28, and then it comes back to 26. So we're planning like it's happening next year to be ready for when it happens. Another positive that I've seen as I'm watching and listening to the news and reading the information is Robert F. Kennedy Jr. is reorganizing the alphabet soup that is the areas of the federal government that handle healthcare. You have HRSA, the Health Resources Services Administration, that works or oversees, because I never can remember the actual reporting structure, the Bureau of Primary Healthcare, which we call BIPIC, which has part of Health and Human Services, HHS, and then CMS, the Center for Medicaid and Medicare Services. So they're reorganizing how those function. And as he was outlining that plan for that, community health centers on his prevention and healthiness were top of the list. Specifically, federally qualified health centers were mentioned by him as being important and being part of how we can make America healthy. And I look at that as a positive for us that we're being recognized. We're being seen as a group that is important to the overall healthcare of our community and of our country at a good deal. We're a value. We're a bargain. When we talk about all the data and the information and the big picture across our country, health centers, about 1,400 of them across the United States, took care of 32.1 million people in 2023. That was about 9.5% to 10% of our overall patient population in the country. Right? When you think about the big numbers, you're like, 32, that sounds like a lot. Well, 10% doesn't sound like much, but when you've got 380 million people in the country and we're taking care of 32 million of them, it's a big number. Our contribution to the actual healthcare expenditure in the country is about 1% to 2% of the overall spend. So when you take that information, you can say, look, we take care of people, we take care of a volume of people, and we do it in a cost-effective manner. Help us do more of that in that same cost-effective manner.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.